Have you ever finished a meal and immediately felt overwhelmingly sleepy, wanting to lay your head down on a pillow right away? Many people consider this normal. When you're full, you should rest, or jokingly say it's because of tight belly skin, loose eyelid skin. However, postprandial somnolence, sleepiness after eating, that occurs frequently, comes on quickly, and is hard to resist, may not only be a sign of overeating, but could also be a warning signal for some underlying medical conditions that need examination. This video will explain the biological mechanism behind the feeling of sleepiness after eating, analyze 4 dangerous diseases that may be hidden behind this symptom: hypothyroidism, diabetes, heart disease, low blood pressure, and provide signs to recognize, necessary tests, and measures for treatment and prevention. Join us in everyday life to learn more. Why do we feel sleepy after eating? Clear scientific explanation. The folk saying tight belly skin, loose eyelid skin is not entirely wrong. It describes a physiological reality. After eating a full meal, the body changes blood flow and hormones to prioritize digestion, which affects the brain's alertness. 1. Redistribution of blood flow. When the stomach and intestines start working hard to digest food, blood flow increases in the digestive blood vessels, splanchnic region. As a result, the blood supply to the brain and other organs temporarily decreases slightly, making you feel drowsy and sluggish. 2. Hormonal changes. Cholecystokinin, CCK, secreted in the small intestine when food is present, especially fats and proteins. CCK signals satiety and can activate brain centers responsible for sleep, making us want to rest. Orexin, hypocretin, a hypothalamic hormone involved in regulating alertness and appetite. When full, orexin levels tend to decrease, which corresponds to increased sleepiness. Insulin and tryptophan, serotonin, melatonin. After a meal, insulin rises to regulate blood sugar. Insulin helps muscle and fat cells absorb competing amino acids, increasing the ratio of tryptophan, a precursor of serotonin and melatonin, entering the brain. The conversion from tryptophan to serotonin and then melatonin contributes to increased sleepiness. 3. Meal composition and quantity. Meals rich in refined carbohydrates, sugar, and heavy fats can cause rapid blood sugar spikes, followed by high insulin release or blood sugar fluctuations, all contributing to fatigue and sleepiness. Overeating, exceeding energy needs, increases both mechanical factors, stomach pressure, and blood redistribution to the digestive system. In summary, sleepiness after eating results from a series of physiological changes. But if this phenomenon is continuous or causes dangerous symptoms, fainting, dizziness, reduced awareness, underlying diseases should be considered. 4 dangerous diseases often hidden behind post-meal sleepiness. Below are 4 diseases you should be cautious about if you always feel sleepy after every meal, along with explanations of mechanisms, suspicious signs, necessary tests, and treatment advice. 1. Hypothyroidism. Why does it cause sleepiness after eating? Thyroid hormones regulate basal metabolic rate, energy levels, and nervous system activity. When the thyroid gland produces insufficient hormones, e.g., low T4, T3, the body's metabolism slows, causing fatigue and sluggishness. When energy must be shared for digestion after meals, the feeling of sleepiness intensifies. Suggestive symptoms besides sleepiness: prolonged fatigue, unexplained weight gain, cold hands and feet, dry skin, hair loss, constipation, slow reflexes, poor memory, mild depression. Tests and diagnosis: blood tests, TSH, elevated in primary hypothyroidism, free T4, decreased. Sometimes thyroid antibody tests, if Hashimoto's suspected. Treatment and management: hormone replacement with levothyroxine as prescribed, monitoring TSH to adjust dosage. After hormone control, many report significant reduction in fatigue and sleepiness. Temporary advice: If hypothyroidism is suspected, see a doctor for testing. Do not self-medicate. Maintain a balanced diet, get enough sleep, and exercise lightly regularly. 2. Diabetes, especially postprandial blood sugar disorders. Why does it cause sleepiness after eating? In diabetes, insulin and blood sugar regulation are impaired. After meals, diabetics may experience prolonged hyperglycemia, causing fatigue, or, in some cases, an excessive insulin response, leading to reactive hypoglycemia. Both conditions cause sleepiness and weakness. Accompanying symptoms: excessive thirst, frequent urination, unexplained weight loss, slow healing wounds. If hypoglycemia, trembling, sweating, anxiety, rapid heartbeat, altered consciousness. Tests and diagnosis: fasting blood sugar, HbA1c, to assess long-term glucose control, or glucose tolerance test if needed. Postprandial glucose measurement can help detect elevated blood sugar after meals. Treatment and management: diet control, smaller meals, prioritize foods low in refined starch, increase fiber, adequate protein, and healthy fats. Monitor and adjust medications, if on diabetes treatment. Light exercise after meals, walking 10 to 20 minutes, helps stabilize blood sugar. Note: if you have warning signs of diabetes with excessive sleepiness, get tested for timely diagnosis and treatment. 3. Heart disease, heart failure, cardiac dysfunction. Why does it cause sleepiness after eating? Heart disease reduces pumping ability, decreased preload or cardiac output. During meals, blood is prioritized to digestion. If the heart cannot compensate, blood flow to the brain may decrease, causing fatigue, confusion, and sleepiness. Heart patients may also feel weak after eating or experience recurrent shortness of breath. Accompanying symptoms: shortness of breath on exertion or lying down, leg swelling, severe fatigue even at rest. Chest pain, palpitations, fainting or near fainting. Tests and diagnosis: electrocardiogram, ECG, echocardiogram, BNP, NT, proBNP tests can help identify heart failure. Stress tests or coronary angiography may be ordered if needed. Treatment and management: treat underlying cause, heart medications, diuretics, lifestyle changes, coronary interventions if necessary. Adjust meals, avoid overeating, limit salt if swelling present, avoid lying down immediately after eating. Emergency note: sleepiness accompanied by chest pain, severe shortness of breath, or fainting requires immediate medical attention. 4. Low blood pressure, especially postprandial hypotension. Why does it cause sleepiness after eating? Low blood pressure occurs when vasoconstriction and blood pressure regulation cannot compensate for blood shifting to the digestive system after meals. This causes a drop in blood pressure after eating, common in the elderly or those with autonomic nervous system disorders, leading to dizziness, sleepiness, and even fainting. Accompanying symptoms: dizziness, blurred vision, cold sweat, lightheadedness, mild fainting. Symptoms usually appear within 15 to 60 minutes after eating. Tests and diagnosis: measure blood pressure before and after meals at 30, 60, 90 minutes to detect drops. Review current medications. Some blood pressure drugs, Parkinson's medications, sedatives may worsen symptoms. Treatment and management: eat smaller meals, avoid overeating. Increase salt intake moderately if approved by a doctor. Stay hydrated. Avoid standing up suddenly after meals. Walk gently instead of sitting or lying down immediately. In severe cases, doctors may consider medication or evaluate for autonomic nervous system disorders. Other non-disease causes to note: chronic sleep deprivation or poor sleep quality, snoring, sleep apnea, causing daytime fatigue and post-meal drowsiness. Medication side effects: sedatives, some antidepressants, antihistamines can cause sleepiness. Psychological disorders, depression, chronic stress, also cause fatigue. Alcohol consumption, overeating sweets, both increase sluggishness. Practical advice to reduce post-meal sleepiness and maintain health. Adjust meals. Eat smaller portions. Avoid overeating. Prioritize balanced meals with protein, fiber, green vegetables, and complex carbohydrates. Limit refined sugar, sweets, and sugary sodas. Reduce excessively oily foods. Add protein and fiber to stabilize blood sugar and reduce insulin fluctuations. Post-meal habits. Light walking for 10 to 20 minutes after meals aids digestion and stabilizes blood sugar. Avoid lying down immediately after eating. If resting, sit comfortably rather than lying flat. Regular health checkups. If sleepiness is accompanied by abnormal signs, memory loss, weight loss, excessive thirst, frequent urination, shortness of breath, fainting, see a doctor for basic tests: blood sugar, TSH, ECG, blood pressure. Consult your doctor if your medications cause sleepiness or low blood pressure. When to see a doctor immediately? Sleepiness after meals occurs continuously every meal and reduces quality of life. Severe dizziness, fainting, chest pain, shortness of breath, or altered consciousness appear. Accompanied by unexplained weight loss, excessive thirst, frequent urination, possible diabetes signs, symptoms of heart failure, leg swelling, progressively worsening shortness of breath. Post-meal sleepiness is often just a reflection of overeating or inappropriate meal composition. But do not be complacent if it happens frequently, severely, or with other signs. It could be a clue to hypothyroidism, blood sugar disorders, heart disease, or low blood pressure, conditions that require timely diagnosis and treatment by a doctor. If you find this video helpful, please like and subscribe to the Everyday Life channel to receive more easy-to-understand, scientific, and practical health and lifestyle tips. If you want, leave a comment sharing your personal experience. Do you often feel sleepy after eating? What foods trigger it? I will select and make in-depth explanatory videos based on your questions. Wishing you smart healthcare and alertness to all your body's signals. Thank you very much, and see you in the next videos.